been working with Nigeria for a few years now. Mostly it's a Christian nursing school. It's I guess similar to an AS degree equivalent. It's not a BSN. And the Nigerian government, well, not government, the Nigerian Nursing Council had sent out a mandate in 2018, and they wanted to bring up the level of nursing education to international levels. So they had sent out this mandate saying that if the School of Nursing was not attached to a university, so like the freestanding school, they had to, work on their curriculum to bring it up. So I worked with them to help with that process. So they eventually got accredited to a college of nursing. And so like Rahima was explaining, I think I could say in most of the African countries, the way that nursing education is taught, I think because of the population and the infertility, the fertility rate. So nursing at the licensure level, the nurses, after they finish the nursing school, so how it was there, when they finished and they took the boards and they passed, then they had 2 additional years that they went on for midwifery. So at that level, they can do like what she's describing. They can, deliver babies, they can take care of pregnant women, even with complications. So and once they passed their license, they were considered midwives. So that's how the nursing education is there. Like she said, and for all nurses all over the world, we do spend the most time with the patients than the physicians. But what is unique there is the fact that the ratio of physicians to patients is really low. In some places could be worse, especially the low middle income countries. And even for nurses, because a lot of their professionals they're having brain drain. They're losing their stellar physicians, and some of the physicians, Nigeria has some of the best physicians in the world, to be honest, and they're out of the country. Same thing for nursing. So we have a limited supply of healthcare providers to the patients. So from that perspective, you can see there is more autonomy for the regular nurse at the grassroots level. And it depends whether it's rural or whether it's in the bigger cities. So some of those factors are come into play. What I have seen is where I go, that particular school, it's a missions hospital attached to the School of Nursing. It was started by a physician and his wife from Canada. They were missionaries. And so they came to that part of Nigeria, started the School of Nursing. And so they've since passed, and their children were born there. They're white, not living in there anymore, but they're adults now, and they wanted to, keep the legacy going, keep the school. And they put a lot of their own money and got people to donate and so on to revitalize the school and, and all of those things that they're doing. And it's fine. They get a lot of volunteers from the missions like Doctors Without Borders and Samaritan's Purse. And these people, they come and they volunteer their time and they perform surgeries and they do all sorts of really great things for the people. But what I see, and this disturbs me, is that they get a lot of nurses coming in from America, some too from Canada and England, but a lot from the US. They go twice a year and they come, and some of them spend months and they work with the nurses. But I think we need to be respectful of people's culture and what their scope is based on their country's guidelines. So for instance, in Nigeria, you have the Nursing Council that makes the guidelines for nursing scope. And the standards is the same wherever, right, for nursing, but for the scope. And also in terms of the way things are done, it may not be done in specific, with specific titles and topics like we do here in the US, but it's incorporated in the care that is performed. And so I think we have to be mindful of that mindset that because of where it is and who they are, they're not as good as, and I see that. And it really bothered me. I spent 3 months there on a research project working on in that, it's a remote part of the country, and knowing the risk factors for post-perinatal depression, I wanted to bring that there, bring the education, and the knowledge and everything to the nurses, and then have the patient screened and bring that process into the care. And so I did that research, and in doing the screening and all of that, educating the staff, the patients, it took out, a few months I was there. And I did see that. And what I saw was even the physicians being more respectful of the foreign nurses. And really, we had a lot of issues with low morale, with the Nigerian nurses. So it is important for us to share and disseminate knowledge, because the body of nursing as a profession is important. I mean, we are one, that's how I see it. But I think we have to be quite mindful of our sisters and brothers in other countries and what their scope of practice is, and what are some of the factors that govern what they can and cannot do. I think those are important things as we, branch out to help and to share and to integrate and collaborate from a global perspective.